Assalamu alaikum wa rahmatullahi wa barakatuh. You are listening to the Bima Health Show with me, Amr Salem, on Ramadan Radio London 87.9 FM, online on ramadanradio.org, and streaming on Facebook and YouTube. Please give us your feedback, questions, and comments on Facebook, YouTube, or call, text, or WhatsApp on 077 614 60614. That's 077 614 60614. So my name is Amr Salem, and I'm an ear, nose, and throat specialist at Barts Health and Homerton University Hospitals at London. And what I really want to talk to you about today is nasal allergy. So the question is, do you tend to get regular or episodic problems with your nose? Do you get itching of the nose, running of the nose, running of the eyes, blockage of the nose, headaches associated with it, trickling to the back of the throat of mucus? Does that happen every day? Does it happen certain times of the year? Does it happen certain periods of the day? If any of that happens to you or any of your children, you might need to consider that you actually have nasal allergy. So what really is nasal allergy? Nasal allergy is where the nose and the sinuses try to react against something that you're breathing in a way to try to get rid of it before it goes down to your lungs and causes more problems. So how do they react? They start first by causing the itching. That's the alert to you, telling you, oh, there's something that's not good that you've breathed in. And then they try to flush it away. And that's the runny nose, the watery eyes. And then if they can't, it gets even more. So it starts to swell up inside, becomes more blocked in the nose and the sinuses. That's when you have problems breathing through your nose or get headaches because of that. You can also get, with the itching, some sneezing, trying to get rid of this stuff. The problem is that nasal allergy can start by the simple sneezing and itching, but can go all the way to constant blockage of the nose, constant breathing through the mouth, disturbing your sleep, affecting your work or school, or your daily activity and sport. That's why if you do have any of these things, you need to consider nasal allergy. So what could you be allergic to? There are multiple things. Some of them are seasonal, some of them are just around us. So you could be allergic to trees and pollen, which happen more somewhere between February and June. Or you could be allergic to grass, which happens a lot more after that, so around May to July, or even weed that can start from June, July, go all the way up to September, October time. Or it could be something that's just around us, like fur or feathers. That's like dogs, cats, birds. Or it could be from mold, which unfortunately you can have in certain establishments or houses. But one of the also very common things that surrounds us that causes this allergy is house dust mite, which is something that is in the bed linen, in the carpets, in the cuddly toys, and can cause a lot of allergy, and is very commonly something that we find in a lot of patients. So what do you do if you think you have nasal allergy? Most importantly, you have to consult your GP. You have to ask your GP to listen to you, examine you. They might start you on some medication, or they might want to have some tests done, blood tests, skin prick tests. And if they find that it's very advanced, they might even want to refer you to a specialist at the hospital. So what can we do to try and help ourselves if we do have nasal allergy? There are a few things that have been found to be very useful to help with nasal allergy. Let's start with one. Understandably, avoidance of the allergen is one of the most important things in treating a nasal allergy. So if that is something that is around you and you can avoid it, like dogs, cats, birds, that's great. But the problem sometimes lies more in stuff that surrounds you and it's difficult to avoid it. So for example, people that have allergies to trees, pollens, grass, what people commonly call hay fever, what do you do? So you can find out when there is times for high pollen season. You can find that online on the internet. There is websites like Allergy UK that can tell you that. And when that's happening, you try and avoid opening the windows for a long time so that the pollen doesn't come in and just attach itself to the furniture or the carpets or the clothes. You also need to consider that when you come back from work or school, that you will need to change your clothes straight away because on it there will be some of that pollen or tree or grass. You can also consider regular vacuuming the house or using an air purifier. Another thing, house dust mite, very common allergen, very common problem happening with people. People usually realize that they have house dust mite allergy because their nose starts getting more itchy and discharging a lot more at night when they're sleeping or when they wake up early hours of the day, but then it gets better afterwards. So it's a lot more to do with the linen in the bed or the carpets. So if you do have house dust mite allergy, you might need to consider a little bit more ventilating the room. Don't make it very hot in the room because heat tends to make house dust mite grow more. Regular vacuuming is very important, and regular changing and washing of the bed linen is also important. You might need to consider not having so much cuddly toys because the furry part of it can keep the dust in it. So avoidance is one of the most important ways of managing allergy. So for people that have just joined us, you're listening to the Bima Health Show with me, Amr Salem, talking about nasal allergies on Ramadan Radio London 87.9 FM, online on ramadanradio.org, and streaming on Facebook and YouTube. Please give us your feedback, questions, or comments on Facebook, YouTube, or call, text, or WhatsApp on 077 614 60614. I was just talking about nasal allergies and how it can be starting from as simple as itching and some discharge from the nose and watery eyes, all the way up to nasal blockage and disturbing your sleep and work pattern and school pattern or even school activities or sports. And I was talking that it could be seasonal, like hay fever, or it could be something around us, like house dust mites, dogs, cats, or birds, and how you need to see your GP to diagnose it. And then from there, we started talking about ways to help us. I have a question here. It says, when cycling at moderate pace, I get rhinorrhea, so gets discharge from the nose. Have to blow the nose every 5 minutes or so to remove excess. Is that allergy? Mostly that is not allergy, unless you're cycling in a place where you're most probably inhaling something, or if it happens at a certain season, but you mentioned that it doesn't happen in a certain season. That is most probably another type of rhinitis, another type of irritation of the nose, and it's from the cold air. You might consider wearing a mask, which would be great these days with COVID, but there are the special masks where cycling, and that will help either humidify a little bit the air, but at least not get so much cold air inside your nose, because that in itself could be an irritant to the nose. So no, I don't think that is allergy. I think that's more a type of rhinitis that happens with the cold, dry air that you get while cycling. So back to the points. We were talking about different things that we can do to try and help ourselves with the allergy. I have to reiterate the fact that whatever we do, we are helping ourselves against the allergy, but we are never curing the allergy. So whatever we need to do is to help us keep going on. You can keep doing these even if you're on treatment for the allergy, because it will help and boost that treatment. So we started by talking about avoidance, and we talked about regular ventilating of the room, air purifiers, carpet vacuuming, changing the linen, changing your clothes when you come back from home or from school or work. Another thing that's very common internationally now in cases of allergy of the nose is something we call saline nasal douching, which is, in simple words, using salt and water to flush the nose and clean it out. You can buy it over the counter, or you can even make it up yourself. A large glass of warm water, a teaspoon of your salt from home, and a teaspoon of the sodium bicarbonate, which is something you use regularly in cooking. You mix them together, you stand on top of the sink, you put a little bit in your hand, you breathe it in, and you blow it out. Does that sound familiar? Absolutely. It's exactly like the istinshaq in your wudu. We do it 15 times a day. And it's proven to be incredibly useful. It helps the nose become moisturized, and it helps clear it of the allergen and of any discharge that has been formed inside it. For people that feel that it's difficult to do the breathing in for the nasal douching, you can use one of those simple syringes that you can get that we use for children's medicine. Stand on the sink, use it, get some secretions, get some of the liquid, squirt it in the nose, and blow your nose. So the usage of the saline douching is incredibly useful. Another few tricks. The usage of a little bit of Vaseline just at the very opening of the nose, and just squeeze the nose. That will stick at the edges of the nose at the front. You can do that before you're expecting to be exposed to the allergen. So say, for example, you have house dust mite allergy. Before you go to sleep, you can do that. You have tree or pollen allergy and you're going for a walk next to a park, you can consider doing that. And when you're finished, wash your face, blow your nose, it will come out. The benefit of it is the allergen is going to stick to the Vaseline rather than go inside the nose and cause more irritation to it. and you're going to get rid of it easily after that. Another very important thing to think about is smoking. You need to avoid smoking whether as an active smoker or a passive smoker, because smoking makes your nose very congested and swollen, which makes you then react even more to your allergen. There's a couple more tricks that can actually help with the secretions, and the Prophet ﷺ did mention about them. One of them is he used to put a couple of spoons of honey in water and drink it. And this has been proven even in the literature to help soothe the throat and break down and get rid of any secretions that have dripped to the back. The other thing is the dairy products. I know there's a bit of a debate about it, but there has been proven papers also, and Prophet ﷺ mentioned it, that milk has a lot of fat in it, which makes your secretions a lot more thicker. So when you drink milk, you need to be a little bit careful about the amounts you drink. And if it is very fatty, you might want to drink some water after that. So decreasing your dairy intake might also help decreasing the thickness of your secretions. So to summarize that part, we talked about nasal allergies. We talked about how they cause itching, they cause nasal discharge, they cause blockage, they can cause sleep disturbance, they can affect your day-to-day life. We talked how you need to go to the GP to be diagnosed. We also said that you might need to have some treatment, but next to the treatment, or even aside from the treatment, there's a few things that you can do to help you, like avoiding the allergen, whether that is by keeping the room vacuumed, ventilated, not very hot, regular changing of the bed linen, regular changing of your clothes when you come back from home. Also, the usage of Vaseline in the nose, the usage of the saline douching, the cleaning of the nose. There's also avoiding smoking and considering using honey or decreasing your dairy intake. I've got a question here asking me about, can nasal allergies cause bleeding from the nose? Nasal allergies can cause swelling inside the nose. And if the nose is swollen and it becomes dry, that can actually start bleeding from the nose. So the answer in a way is yes. But then when we look at the point of the saline douching, the salt and water that we squirt in the nose and blow out, if we can do that once a day, or even our regular istinshaq that we do 15 times a day with our wudu, that will help moisturize the nose. And with that, the tendency of bleeding is going to be a lot less because of the moisturization that happens with the water going in. And also avoiding excessive hotness inside the room. That can also help avoid nasal bleeding. And that actually brings me to a very important thing that I wanted to talk about also, which is the medication that we use for nasal allergy. And the reason why I'm prompted to talk about it, and I get a lot of questions about it in clinic, is because of two things. People are being more conscious about risks of medication. And also, a lot of the medication is actually available over the counter. So the question is about the medication. I want to talk about it for a few minutes. The over-the-counter tablets for antihistamine or syrup for children help us to avoid the reaction we are getting from the allergen, which is very useful if you do have allergy. But a lot of the over-the-counter tablets or syrup can make you slightly sleepy. So if that's the case, you might need to consider taking it more towards the end of the day rather than the start of the day. And yes, they can sometimes in excess cause thickness of the secretions. So if you were diagnosed as having allergy by your GP and asked to take antihistamines, please consider how much you take and more towards the end of the day. The other thing about the nasal sprays, there are a lot of nasal sprays that are available over the counter. Some of them are just saline, salt and water, which is very useful, as we said. Some of them are steroids. And a lot of people are scared and worried about the steroids. Oh, they're going to be absorbed in my body and they're going to cause trouble. That is not something that's been documented before ever with nasal sprays. So they are safe. They stay in the nose mostly, and they don't get absorbed by the body. Their only problem is they can actually cause the dryness of the nose sometimes, and yes, they can lead to the bleeding of the nose, which again, the regular moisturization with the saline douching next to the spray, but please use the saline douching before the spray rather than after, so it doesn't wash out the spray, as I'm sure you get it. That will help avoid that risk with the spray. But otherwise, they are very safe. Anything more than that will have to be prescribed by your GP or a specialist in the hospital. I've got another couple of questions here. Many people suggest royal jelly capsules for the treatment of acute hay fever. What do you think? I am sorry to say, but I can't give a formal comment on that. There has been papers that have talked about the usage of honey in decreasing the inflammatory effects of a lot of things. So definitely the allergy is one form of inflammation. So the usage of royal jelly or honey definitely is something that will help. But is it the one and only way of treatment or just on itself? I can't answer to that. But I can only remember that Allah subhanahu wa ta'ala said to us about honey that فيه شفاء للناس. It helps heal us. The other question is, what is the best way to treat epistaxis? Epistaxis is bleeding from the nose. And the best thing to do about epistaxis, if it does happen, squeeze the nose, put your head forward, and wait like that for 2 or 3 minutes. Usually the bleeding comes from the front of the nose, and that's why the squeeze of the whole part here is very important. And head forward so that if there's any bleeding, it falls in front of you rather than falls to the back of your throat and you have to swallow it. It doesn't taste nice. And usually after a few minutes, it will stop. If it doesn't stop, then yes, of course, please seek advice or go to A&E and get seen. But also, going back to the bleeding point, the reason why people bleed from their nose usually comes because of the dryness inside the nose. So even the regular usage of Vaseline inside the nose once or twice a day makes it moisturized. The regular istinshaq and the regular water going inside the nose helps it stay moisturized. That makes the lining in the nose not very dry. And if it's not very dry, it won't crack. And if it doesn't crack, the possibility of bleeding is a lot less. So simple things can help a lot with bleeding from the nose. So to sum up, what we talked about today was nasal allergies. Itching, nasal discharge, watery eyes, blocked nose can affect you on a day-to-day basis, can affect you in seasonal times, can affect you anytime. How to avoid it? Find out what you're allergic to. Try and avoid being next to it. Keep your rooms ventilated, vacuuming, regular changing of linen, regular changing of clothes, air purifiers, usage of saline douching, usage of Vaseline, avoiding smoking, avoiding hotness, definitely seeing your GP and starting treatment. I can see one more question here. Would nasal allergies affect the smell sensation if the nose is very blocked? Yes, of course, because you smell by the very top of your nose. So the air has to find its way all the way from here, all the way up to there. So if it's swollen or blocked, then yes, your smell can be affected if you do have nasal allergy. And at that stage, yes, you do need to clear your nose, again, whether by water or if it's very swollen, then by usage of treatment, medicine, or nasal sprays, preferably guided by your GP or by a specialist if you were referred to one. I hope this was really useful to everyone. Jazakallah khair, and thank you for listening. Oh, there's one last question here. Is there a link between nasal allergies and irritation or swelling and heat in the ear canals? You can get the same symptoms of allergy in your ear canal, similar to the symptoms that you get in the nose, but it doesn't mean that you are definitely allergic to it. Again, please see your GP about your ears, because allergy in the ear is not as common as allergy in the nose. So, Jazakallah khair for listening to me. Thank you very much. Thank you for listening to me, Amr Salem, on Ramadan Radio 87.9 FM. Till next time, Assalamu alaikum wa rahmatullahi.